Entrepreneurs are addressing problems in U.S. healthcare, like access to primary care, but they need mentors and investors to scale up and make a real impact. Private equity has some bad connotations, especially in healthcare delivery. Why is that? And what are investors doing to prove their worth? Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the Health Biz podcast, where I interview top healthcare leaders about their lives and careers. My guest today is Ariez Dustoor, partner at NB Group, where he's helping build durable healthcare businesses with an active and supportive approach. Do you like this show? If so, please subscribe and leave a review. Ariez, welcome to the Health Biz podcast.
Thanks, David. Great to be on, and appreciate you having me on.
And we're going to talk about what's happening in the healthcare investing and entrepreneurial world these days. But I always like to roll it back to the beginning, learn a little about your childhood. What was your childhood like? You know, any childhood influences that have stuck with you in your career?
Yeah, I grew up. So I grew up in the Midwest. I was born in Ohio, and when our family was, when I was, 5 years old, we moved to West Michigan, to Grand Rapids, Michigan, and so I did all my kind of schooling there, and then went to university at University of Michigan, which is also where I met my business partner. So kind of have those Midwest roots. Lots of memories and formative, I think, influences growing up. I think one that I was reflecting on this morning in terms of my business career and what I do now is, we always had tons of books and magazines around. And I remember having Business Week and Fortune and these kind of business magazines just laying around. And I think at a relatively young age was reading all of that and kind of got interested in business and all the different stories there. And so I think that was a major influence.
That sounds good. So I saw you went to Michigan. It's a convenient place to meet your business partner. That sounds good. I think you studied political science and history. What was your interest and orientation toward that?
Yeah, I'd always had in middle school, high school, I'd always been more interested in kind of reading, writing, history, things like that, than necessarily sciences. I didn't particularly enjoy math, or chemistry, or biology, or anything like that, though I did pretty well in those schools, those topics, at least academically. So I was always interested in those subjects. I did think kind of going into college that I would pursue some type of, so after college, either go to law school or pursue some interest around kind of politics and public policy. And so those subjects fit well. And I think it's changed today, the way that people think about their careers and how pre-professional college has gotten. But I certainly always felt like if I wanted to go into business, if you went to a good school, you could kind of study whatever you wanted. And if you did well, you'd be able to get a job and kind of pivot into business. So sort of pursued that path. A lot of other people I know, especially at Michigan, it has an undergrad business program. And so they went that direction. But worked out for me.
That sounds good. So give us a little sense of your career arc. I think you started off at McKinsey and then went on from there into some PE, some tech, some finance. How did it transpire?
Yeah, I've had a number of different kind of, variations of my career. And I think part of that has just been sort of figuring out what do I want to do and in what format do I want to do it. But I started my career doing strategy consulting at McKinsey Company. I was there for 2 years. It was a great experience, awesome experience right out of college, but I knew I sort of didn't want to do that as a career path. I had an interest in investing. There was a natural, private equity was a very natural transition from McKinsey. So I ended up joining, fairly large middle market generalist private equity firm in Boston. I wasn't there for super long. I was there for about a year and a half. I think I enjoyed the work. I did not enjoy and was probably just not a good fit for kind of the environment at a big firm like that. It was also, I joined in 2008, which was probably the worst time in history to
be inauspicious. Yeah.
Trying to start a career in anything related to finance. So after that, ended up moving out to the Bay Area on the West Coast. I was doing M&A and investments at Yahoo in and around consumer internet for a couple of years, and then had an entrepreneurial itch, wanted to do something more operational. And so ended up leaving Yahoo after a couple of years, moving out of kind of transactions and investments. And prior to starting our firm, I ended up starting a software company with a set of partners. And I did that for, I think, close to, in total, 4 or 5 years. We were starting to transition out of that. And so I was thinking about what I wanted to do next. I knew I wanted to get back to investing. I did not want to be operating, but had kind of an entrepreneurial itch, wanted to do something on my own, and kind of started having discussions with my partner. He was in a similar place. And so starting in 2017, we established our firm and really started working together on what we do today on a full-time basis.
Sounds good. So this company's called NB Group. Any NB have any particular meaning?
Yeah, it's actually the initials of my partner. So he was kind of hunting for deals and investments probably, I don't know, 9 months before I got fully involved. And we, just for ease of getting started and not having to build a new website and all of that, we kind of kept just kept the name, and I wasn't hung up on it. And, it's just sort of stuck.
Yeah. It didn't sound like it means anything too particular anyway. I don't think you feel
fairly generic,
alienated from it. Yeah. It could be like NB, it could be like some type of a widget or something.
We do have to sometimes clarify, it's Nancy boy, it's not, MD or something like that. But.
Yeah. Okay, good. All right. So my first question about that was going to be about how you ended up there, but it sounds like, so you met your business partner in college. Did you know you were going to partner on stuff later on? What had the interaction been like up along to that point? You just found yourselves, hey, all right, we're both at this similar stage. Let's go in and do this together.
There was no grand plan here. We weren't sitting around, drinking beers when we were 20 years old, talking about starting a business together or something like that. We were close friends, and we'd had pretty similar career paths. Both started careers in consulting, both worked in private equity, and I think this would have been 2014-ish. We were both living in New York City, and I think. And we're keeping in touch after. Yeah, I ended up moving out of New York, but I was visiting on like a monthly basis. And we're keeping in touch and started having these conversations. I was talking about what I wanted to do next, and it just sort of evolved organically from that.
That sounds good. So how would you describe what this company is? Is it a private equity firm? Would you describe it as something else?
It's a private investment or a private equity firm. So we do private equity style investing. There's some differences maybe between us and a traditional private equity firm, but fundamentally we're investing in similar types of businesses. The way that we create value, the way that we take, $1 of investment and turn it into $5, the mechanics are the same. But we have, I think, have an approach that is a little different than some other firms.
Now, your background is partly in investing, but also as an operator, also as a consultant. How has that experience informed your investing approach as opposed to, let's say, if you've just done purely finance?
Yeah, I think there's a couple elements to it. I think one is there's just probably a little more empathy for how hard it is to run and build a business as an operator. So when we invest in a company, we don't run the businesses day to day. We rely on a CEO, a co-owner, a management team to do that, but we can be quite involved. But there's always going to be a difference between there's always a distance that we have from the business that the operator or entrepreneur doesn't. And so I think having some empathy for how hard it is important. And I think specifically, sometimes it helps me think through being mindful of trying to be helpful, trying to plug in, trying to push, but also giving the operator space to run the business and to make mistakes. I think that's one piece. I think the second is, as especially when we were first started and we're building our firm, we're starting a business. It's not exactly the same thing. We're starting an investment firm, but fundamentally we're starting from scratch. We don't have anything. And we have to go build it. And I think there is an element of, I like to just call it hustle, that is required, or, kind of, to use rawer language, like get shit done, that I think you need to have as an entrepreneur. And we were able to sort of bring that to our firm when we started.
So what are some of the investments that you've made as NB?
Yeah, we've made, so as a firm, we focus on two core sectors. One is what we call multi-location services. And so these could either be consumer services or business services, but these are businesses typically where there's some physical footprint, whether it's a store, it's a clinic, they have a fleet of vehicles that they're using, and expansion of the business in large part can be achieved by expanding geographically. And so examples of businesses that fall under that are, we invested in a large gym chain. We've been pursuing a roll-up or acquisition strategy around hair waxing studios in the US. So both of those would be examples of this kind of multi-location focus. The other sector that we focus on, and we've really been trying to build out our investment program there, is healthcare. And so within the healthcare space, I think a very kind of prototypical example of the business we've invested in is a primary care. We sort of call it prevention-focused primary care, but it's a primary care practice management group based out of Oregon called One Peak Medical. And we've been involved with that business for a couple of years and have seen, very strong growth in the business. And so I think we could talk more about what that business does and primary care generally, but I think that would be a good example.
Great. Yeah. So let's talk about that. So primary care, it sounds like you're interested in that. In fact, I think everyone's interested in primary care. I hosted a panel discussion on this topic, and I was joking to drive more participation. We should just advertise that, hey, we'll hook you up with a primary care appointment if you come, because everyone seems to be looking. So it's both just to come in person, and then also people in healthcare trying to figure out primary care. So it's a tough one. And you've seen some big, I think it's now gone far enough to say, some big failures in that area with large companies. Thinking about the large drugstore chains, for example, trying to get into primary care, spending billions and then having to write it off. And so I'm wondering, obviously you're doing something a little bit differently than that, but I'd be interested to hear kind of what the success plan is there. And it sounds like you've been getting some strong growth.
Yeah, I mean, we like primary care, and I think in particular we like models that are innovative. So they're doing something a little different than the way that primary care has traditionally been practiced. But I would say that make a couple of general comments first. I mean, one is there's a major shortage of primary care capacity in the U.S. So, simply put, there are not enough providers, there are not enough options for patients when it comes to primary care. And so that creates some really interesting opportunities. And it's also something that we want to be part of solving. I think a second is that the way the whole system is moving, so both patients and providers want to be more prevention focused. So I think there is more recognition than there's ever been that we should not be waiting till people have acute healthcare problems to be seeing a provider, and that we really need to be managing people's health. And health is not just, do I have a headache? Do I have a flu? Did I break my ankle? I'm 50 and now my cholesterol numbers have spiked. It's really, holistically managing how you feel, what your test results are showing, how your body is operating over a long period of time. And so I think primary care, there's been too much focus in the system just addressing like acute issues. And I think primary care is really the front line of that. And that's not only is that good for people from a perspective of just you feel better, you live longer, all those things. It's better from a cost perspective. Because when we wait for these issues to get out of control, it's much more expensive than addressing it on a more ongoing and proactive basis. So I think those are sort of philosophical or large, large changes and trends in the healthcare system that are sort of make primary care a really good place to be as an investor.
So let's talk about that a little bit. I also see people, especially generation, say younger than 50, embracing the idea of prevention, longevity. You see a lot of these kind of approaches, and I would even tie it in. I don't know about your specific investment in the in gym chains, but I'm seeing it also tied in like a broader definition of where prevention occurs. So I was speaking to my trainer at the gym, and they actually had someone come in and talk to the trainers about how what you're doing is part of health and the healthcare system. If you can get someone can lift something heavy and put it down without injuring themselves, you've actually made a big difference. That's similar to what somebody might want with a good diet, and where they could avoid going to the doctor. So I see that, and at the same time, from a business standpoint, the way that I was referring to some of these large chains that hadn't done well with primary care. I think there's various reasons, but one is just looking at primary care as a business itself. The reimbursement is lower for things like prevention and higher for things like procedures, which tend to be done by specialists. And those that have made money on primary care have been more these larger hospital systems that use primary care as a feeder into more expensive and profitable services. So I get the overall idea about why primary care is very helpful for health, which people want, and prevention. How do you make the numbers add up?
Yeah, so I can maybe talk more specifically about what we're doing at One Peak, which I think is taking a pretty unique approach to all of this. So one element that I think is unique, and it was something that really attracted us to the business model to start, is the business mostly, One Peak mostly relies on physician extenders. So in this case, it's nurse practitioners. So most of our providers are nurse practitioners, not MDs. We do have MDs as part of the practice, but the bulk of the providers are nurse practitioners. And I think they really function like a full primary. There's no difference in the way that they function between that provider and a provider who's a doctor. They do the same thing. So they write prescriptions, they can make referrals, they're seeing people for the same conditions, all of that. I think that has a number of benefits, but if you go back to what I was talking about with there being a shortage of primary care I'd say primary care professionals in the US, but in particular doctors, well, one way to solve this problem is to expand the scope of who are primary care providers. It doesn't have to be a doctor. And I think that's a major trend you're seeing across the country, and the rules around how nurse practitioners practice is part of that. So that's one element of I think approach we're taking that's unique. I think another is that we have a philosophy that includes it's prevention focused from the start. So your first visit at One Peak, when you first come in as a new patient, it's going to be significantly longer than a traditional visit. We are doing lab testing on most of our patients, with the core philosophy being if we don't test and measure what are the symptoms or signs your body's showing, and also then seeing how is that being managed or changing over time. It's hard to really know if you're doing your job. So it's another kind of core component of what we do. I think your question, David, I guess is really around like economically, how does that all add up? We found that the payers are very supportive of this approach. Ultimately it's resulting in a lower total cost. And we run our practice efficiently. I think we do a good job, and we're doing a better job of using technology. So, it's been a win-win. I mean, it's not been something that we've had to say, hey, we need to change our approach, or we need to tie up with the hospital, or we have to do more procedures, or there's something we have to do to make money because we can't make money on primary care.
Good. All right. Well, maybe it's a regional phenomenon, but I hope it could be more nationwide as well. Yeah, here in Boston, this point about nurse practitioners being a solution. What I heard from that is actually the NPs and the physician assistants PAs are also leaving primary care and going into specialty practice as well. So I think the markets depend, and I do agree that you need to look broadly at the workforce. So I'm happy to hear that it's succeeding. So you mentioned you go across different sectors and you've been involved in kind of general approaches before, and I'm wondering if you might comment on what some of the opportunities and challenges are when you're looking at a healthcare investment compared to, let's say, another business services or consumer services business that's not a healthcare one.
Yeah, I mean, healthcare, as you know, is incredibly complex in a way that I don't think any other sector is. That creates some opportunities, but it creates challenges with understanding businesses, diligencing them, all that. I think the two big differences, if I step back, I think the two big differences between healthcare and other sectors that we might look at is, one is the payer dynamic. The other is the regulatory dynamic. So on the payer side, in most sectors, so you take a consumer business, you take a restaurant business, or you take most business or most B2B businesses. So, a company that sells software to another company, or a janitorial company that's saying, hey, we're selling our cleaning services to large office buildings. I mean, you kind of pick all these examples. As the provider of the service, as the business, you control the price you charge. And obviously there's a market, you have to work within that market, but you have control over that pricing. The obvious difference in healthcare is if it's a reimbursed service, you don't control that, or I would say you control that less. And certainly if you are getting reimbursed by the government, unless you're a very large player or something like that, you tend to be, you're just taking price, you're accepting the price that's in the market. And that creates a lot of challenges. So I think one challenge that you've seen over the last several years is that as the cost inflation's happened for wages, for if you're running a doctor's practice, your front desk staff, your medical assistants, the cost of supplies, all those things have increased. There has not necessarily been a commensurate increase in your reimbursement, and you don't really control that. And so what ends up happening, you just end up making less money. So I think that's one big challenge. The other obvious one in healthcare is just regulation. And I think you have to operate at a really high level with a lot of compliance, a lot of attention to that. But also there's the fact that it can change at any point in time. It can change at the state level. It can change at the federal level. I think you're seeing this right now with, there's a new administration. They're talking about cuts to Medicaid. It's not clear exactly what they're going to do, but this has introduced all this uncertainty into the market now, right? And so any business where you're getting a lot of reimbursement on Medicaid, there's this big open question, and that obviously flows through to investors. So it just ends up, much more complicated sector, I think, to invest in than others. Doesn't mean it's a bad thing, but it's something that you gotta wrap your arms around.
Now, healthcare is expensive, especially in the U.S. It's also a service where there's not that much satisfaction, and it's very emotional. It deals with all the sort of issues, and private equity has been a bit of a whipping boy in healthcare. I think in some cases your colleagues haven't helped their case by certain activities they've taken. I'm thinking of something like Steward Healthcare, which is at the top
kind
level
of big,
in the Senate.
high profile example.
Yeah, exactly. But why is private equity getting pushback in healthcare? Is it just a convenient target, or are there things that are done where you could sort of understand why people would go after it?
I mean, I have I think a relatively balanced view on this. I'm not going to sit here and say that private equity is perfect, or that in all instances it's been great for the system or for consumers. I think there have been high profile blowups of companies that private equity had backed. I think in some of those cases, it's because of the approach that the PE firm took, or they put too much debt on the company or something like that. In other cases, it's hard to run the counterfactual, but sometimes they're investing in businesses that have issues, and those businesses are going to have issues whether a private equity firm was involved or not. But I think you have had some bad actors. I've had some PE firms that have not been a great investor, and that leads to reputational issues for the entire sector. I think having said that, I think there's lots of examples I can point to where I think that private equity's invested in a healthcare business, and that business has gotten stronger. It's been better for the patients, all of that. But there are certainly examples where that's not the case. I don't think the industry has done a very good job, probably specifically in healthcare, but just broadly speaking, I don't think the industry does a great job of telling its story in a way that an ordinary American can understand. Like, what does a private equity firm do? Why is it good? All of that. And I do think like you just said, it's a very emotional, it's your health. There's nothing more important for most people. So when something goes wrong, I think people are looking for someone to blame, and it can be a relatively easy target. In some cases warranted, I think in others, not.
Good. All right. Well, Ariez, my last question for you is for a book recommendation. I always ask my guests if they have any books that they would recommend. And I also ask sometimes if you have anything you would recommend people avoid reading.
I didn't think about that latter question. Actually, it's a good one. So I'll give you two books I recently read. Neither have anything to do with healthcare or private equity. I don't really when I read, I try not to read about business and investing and stuff like that. So one is, I just finished The Anxious Generation by Jonathan Haidt. It's a great book. I have two young kids. I think it kind of has informed. It basically talks about how childhood and the way we raise kids and all that has changed with the advent of both social media and smartphones. And he has some, I think, really interesting concrete recommendations for like what can you do as a parent, but also public policy wise, what should we be doing to address this. And so I enjoyed that book. Another I read recently was a book called World Undone. So history major, I've read lots of World War II history. I've always been super interested in it. I've not really read anything about World War I, and this was kind of a primer that walked through like the whole conflict. And so if you're interested in history, it's really well written, really comprehensive, and I learned a lot that I didn't know before, and was a great read.
Excellent. No, those sound like two very good recommendations. Yeah, sometimes people assume I want to hear about a business book or something, which I don't read those books. So
it's the last thing I want to do, after working is read about whatever, 10 tips to marketing success or something like that. But
yeah,
to each their own.
Good. Exactly. Well, that's it for another episode of the Health Biz Podcast. My guest today has been Ariez Dustoor. If you like what you heard, please subscribe and leave a review. Ariez, thanks so much for joining me today.
Great to be with you.